my name is Paige, and this is my demonstrator Shay, and we'll be breaking down the biomechanics of a single ballet turned out pirouette.
We will start with the foot and ankle. We begin in plie, where both ankles are in dorsiflexion at the talar-crural joint. The gastrocnemius and soleus are the primary movers in this plie as they control the speed of descent in this concentric contraction. There are also synergist muscles in the foot that aid in the plie: the posterior tibialis, flexor hallucis longus, flexor digitorum longus, fibularis longus, fibularis brevis, and foot intrinsic muscles. These muscles, as well as the subtalar joint, help to make sure the foot doesn't excessively pronate or supinate. The foot intrinsic muscles also support the arch. From here, the left foot moves into a releve, which utilizes the same muscles but is now an eccentric muscle contraction. The ankle moves into plantar flexion at the talar-crural joint, supination at the subtalar and transverse tarsal joint, and pronation at the first ray. Your phalanges are in hyperextension at the metatarsophalangeal joint. The right foot goes through the same demi-point position but then moves all the way into passe. The toes finish the point with flexion at the MTP joint. The knees do two different things in a pirouette. The left supporting leg will straighten as we go on to releve. This is extension at the tibiofemoral joint. The end range of tibiofemoral rotation in this knee extension is controlled by the screw-home mechanism. The femur rotates laterally on the tibia, allowing the dancer to stand stable on her leg in this closed chain position. The popliteus muscle is what controls the screw-home mechanism. The quadriceps femoris are the primary movers for knee extension. To be more specific, the rectus femoris, vastus intermedius, vastus medialis, and vastus lateralis tracks the patella in a superior direction, extending the knee. The sartorius also aids in extending the knee and with lateral rotation of the hip. The working right leg moves into passe, which is flexion at the tibiofemoral joint. The hamstrings are the primary movers for knee flexion. To be specific, the medial hamstrings, the semimembranosus and the semitendinosus, contract, creating a co-contraction which aids the knee stabilization and medial rotation of the tibia in this turned-out position, as well as knee flexion. The lateral hamstrings, the biceps femoris, is a synergist to these two muscles as it aids with knee flexion and tibia lateral rotation. The biceps femoris also aids slightly in hip external rotation. In a turned-out pirouette, both hips are in external rotation at the hip joint. The deep lateral rotators are the main dynamic stabilizers for the external rotation of the femoral head at the hip joint. We should focus on our turnout coming from these 6 muscles to increase freedom of motion and decompress the hip joint. The gluteus maximus, posterior portion of the gluteus medius, the anterior portion of the adductor magnus, the adductor longus, and the adductor brevis also aid in hip external rotation, as well as a small contribution from the psoas major. The possulape is also in hip flexion on the frontal plane at the hip joint, as well as external rotation. The psoas major is a primary mover for hip flexion. The iliacus pectineus, the anterior portion of the gluteus medius, gluteus minimus, tensor fascia lata, and anterior portion of the adductor magnus are synergists for this movement. It's also important to note that for your ankle, leg, and hip, the motion of bringing your leg to passe and going on to releve is a concentric contraction as it goes against gravity. While you complete the turn, the muscles are static, creating an isometric contraction, and the descent of the turn is an eccentric contraction. The only differing muscle group is the left hip muscles. Because the left hip stays in external rotation and extension the whole time, the muscles are in isometric contraction the whole time. The spine and core must engage in an isometric muscle contraction to give you spinal stability to complete the turn. As we're rotating on the transverse plane, the spine as a unit slightly rotates to the right. The cervical spine, the head and neck, rotate in the opposite direction, then quickly whip around to the right, otherwise known as spotting. The external and internal obliques control trunk rotation. On a right pirouette, the left external oblique and the right internal oblique will work together to rotate the trunk to the right. The obliques as well as the transverse abdominis and quadris lumborum also aid in spinal stabilization when completing a pirouette rotation. The rectus abdominis and transverse abdomen help pull in the belly and the abdominals, and the quadris lumborum helps depress the ribcage and give us a solid center. It is also important to note that the internal and external intercostals, latissimus dorsi, and pectoralis major and minor help with inspiration and expiration. When we rise into passe, we inhale, and as we descend into our landing, we exhale. Her left arm is in second position and her right arm is in first position. As she moves into the pirouette, her left arm will move into first position through horizontal adduction to meet the right arm in first position. She's now in flexion and lateral rotation at the shoulder joint and flexion at the elbow joint. Her second through fifth phalanges are in extension and abduction at the metacarpal phalangeal joint, and the first phalange, her thumb, is in opposition at the carpometacarpal joint. It is important for dancers to understand the biomechanics of their movement. If we're able to visualize the joint movement in our body, we will have better body awareness when it comes to our dancing. This can help create clarity within choreography and allow us to understand the technical and correct positioning of our body. Having knowledge of our muscles is important because we now know which muscles are supposed to be the primary movers and which muscles we're trying to make the primary movers. This way, we're able to retrain these muscles to work properly. We can correct the form of a movement, do the move most efficiently, and do it in a way that does not expose us to the risk of injury.